I'm Dr. Anchal, radiation oncologist from Apollo, Delhi. I'll be talking in brief about certain myths which are prevalent in the society about cancer. So first thing which people come and ask is whether the cancer is a communicable disease or not. So cancer is not a communicable disease, and patient or their family members can lead a normal life at home. Then they ask whether it is treatable or not. Then cancer itself is a treatable disease if diagnosed in an early stage. People who present late to the clinic can also be treated, but curable or not basically depends on the stage of the disease. Then they come and ask if the cancer is a preventable disease or not, whether there is something which they can incorporate in their life and cancer becomes preventable. Then answer is yes, there are certain cancers which are preventable, like cancers which are related to the consumption of tobacco and alcohol are very much in a preventable category. Then there are certain infections in the body which can lead to cancer, like hepatitis B virus infection. Then there is HPV infection. These infections are preventable, and for these infections there are certain vaccines also which are FDA approved and used prevalently used these days. Then there are infections like EBV infection and H. pylori infection, and this is also a preventable cause of cancer. Then there are certain good things which we can incorporate in our lifestyle, and that also protects us from cancer, like sedentary lifestyle is an adverse lifestyle feature which if a person is having can lead to a cancer in the long run. Then they ask if there is some abnormal lump in the body, or if there is something abnormal in the body, if biopsy can be done or not. People are very scared of getting a biopsy done for an abnormal lump in the body. They think if they are getting a biopsy done, then it will lead to spillage of cancer in case the cancer is there. So the most important thing here is biopsy does not gives rise to spillage of cancer in most of the diseases. There are certain situations in whom we don't advise to undergo a needle test or a biopsy, but those are very few, and clinicians would be the best person to guide you for that. Then people think then cancer treatment is a very tough treatment, and instead of undergoing that treatment they would prefer not to get treated. So cancer treatment is basically is in the form of chemotherapy, radiotherapy or surgery. All these treatments have their own complications and side effects, but these days all these complications can be managed easily, and none of these complications is life-threatening. So cancer treatment is not usually life-threatening. It is basically can be managed easily in most of the situations. So once the patient undergoes all these treatments, cancer chemotherapy or radiotherapy or surgery, then they think then cancer treatment is over and they don't need to see the doctor after that. But this is also not true. Once you take whatever is advisable for your cancer disease, or depending on the site or stage of the tumor, then also you need to visit the hospital or the clinician on regular intervals just to see whether you are doing all right or not. And it is not always necessary to undergo certain investigations, and clinical examination is sufficient in most of the cases. So in conclusion, cancer is a chronic disease which is managed in a manner in which any other chronic disease would be, and treatment is tough, but it is manageable and it is not life-threatening. Cure is possible in cancer if a person presents to the clinician in an early stage, and each cancer treatment is different. It depends on the site and stage of the tumor, and every patient need not undergo chemotherapy, radiotherapy and surgery. Treatment is very much tailor based and depends on the site, age of the patient, and also which disease you are having. So cancer is very much a treatable disease these days. Thank you.